Hello friends, this is Priyabrata Mishra coming to you with a new discussion. Today we'll discuss about the usage of lumbosacral belt. The belt we use in low back pain, when to use, where we use, what types of belt you should use. Let's know today. Indications where we should use a lumbar or lumbosacral belt. It's a lot more confusion in today's medical practice. Let's clear it today. In cases where severe pain, when a little movement is difficult, moving the lumbar spine, where forward bending is restricted or avoided in cases like prolapsed disc, where further movement towards forward bending will precipitate or increase the disc to move posteriorly, hence increasing the pain and increasing the or worsening the problem. Cases where the backward bending is avoided or restricted, like heterolisthesis, where the forward slip of the bone is there, so backward bending again increases the bone to move forward. Are those cases we should not bend backward, or we should not do any exercises that involves backward bending. Chronic spondylosis, where larger osteophytes are robbed during movement of spine, it is very much painful. In those cases also we should wear a lumbosacral belt to prevent the pain. In cases like where the bones are very weak, like osteoporosis, to prevent the compression fractures or any pain, we should wear a lumbosacral belt. If there is any fresh fracture of the lumbar vertebra or lumbosacral vertebra or any spinal vertebra, then at that time we should wear a belt to assist in fracture healing as much as early possible. These are the cases where we should use belt. So if you wear belt, so what are the benefits? Why you should wear a belt? It improves the passive stabilization of the spine. It helps to support the structure passively. So hence the problem inside the spine will reduce. In the result, pain will be minimum. It will help in bypassing the extra weight fall over the vertebrae in patients like obesity or protruded abdomen, where the spinal load is increased. In those cases, if you wear a belt, and the load of the vertebra will be minimum. Helps in delaying early spondylosis in those patients where job is more than 50 kilometers or 60 kilometers per day, they have to drive long. In those cases, if you wear a belt, it will prevent to early spondylosis, early wear and tear of the vertebral bodies or the ligamentums, the disc, all the structures around the spine will delay, and hence the possibilities of early spondylosis will also delay. It will help. What type of belt we should use? Number one is plain belt, plain lumbosacral belt or corset, where the patient's low back is flat. In those patients, the flat back, you should use a plain or flat lumbosacral belt. Those patients have normal lumbar lordosis, they should use a contoured lumbosacral belt. That means the belt is designed as it is the lumbar lordosis is there. In some cases, where there is listhesis, the prosthetist or orthotist will design a belt according to the vertebral pressure, that is known as molded lumbosacral belt or corset. And an important thing is when we should discontinue the lumbosacral belt or the lumbar belt. When the pain is well settled, when the pain in the low back is well settled or reduced to minimum, there is no show pathology nearby, patient is back or core muscles are well strengthened, then at that time, with the advice of your physiotherapist, you should discontinue your belt. If you will continue the belt after the proper rehabilitation or proper back pain management, then what will happen? Now your core and the back muscles will further weak. Again you have the consequences of low back pain what you faced before, or some degenerative low back pain we will face in future. So belt wearing or continuing or discontinuing, you should discuss or you should consult with your physiotherapist to when you wear and when not to wear. If you learn something from this video, do not forget to like, share and subscribe this.